So thank you for your answer. We would like to move to the next topic. So I would like to introduce the student Cao Thanh Binh with the topic prolongation of the arterial phase in the underlying pathological process in women with syndrome S. So please give your presentation.
Good afternoon, ladies and gentlemen. My name is Cao Thanh Binh. I'm a student of Untitled University. Today, I would like to present about prolongation of the arterial phase is the pathological process underlying a syndrome. Before starting, please keep in mind the presenting author and co-investigator have no financial interest, arrangement, or commercial affiliation to disclose. First, I would like to talk about the background. Frequently, women present with symptoms atypical angina pectoris, making ischemic heart disease recognition. As you all know, angina pectoris can be identified as typical angina pectoris as TAP, atypical angina pectoris as AAP, or pseudo angina pectoris as PAP, and a form of AAP called cardiac syndrome is defined as a chest pain with evidence of myocardial ischemia. In the absence of coronary artery disease, the pathological mechanism remains unexplained. That's why the aim of these studies was to examine coronary blood flows based on a novel angiographic technique to explain the mechanism of chest pain and associated symptoms in patients with cardiac syndrome X. Take a look at this. You will see this angiogram were done with the new technique. As the contrast injection stopped, the blood in the white color move in and display the plaque contrast. And during injection, the camera could record the index artery in its full length at 15 images per second. And characteristic of blood flow could be observed and classified by times and time. Therefore, the duration of the artery phase were calculated and compared with control. Now, come to the method. All the patients who enrolled in this study were divided into two groups. The study groups includes 10 patients with confirmed cardiac syndrome X after angiography, and the control group includes 10 patients with normal coronary artery with the left ventricle ejection fraction more than 50% and confirmed non-cardiac causes of chest pain. The patients were excluded if they have significant valvular disease, unstable angina, mid to the severe coronary artery disease. And through the new angio technique, calculate and compare the time of the blood passed through each segment of right coronary artery, left anterior descending artery, left circumflex artery. Here is the angiogram of the right coronary artery. The blood moves from the entry to the beginning of the mid-segment, to mid-segment, to the beginning of distal segment, and to posterior distal artery, and to the end. The blood flow measurement were divided into 4 time periods for comparison. And the first period here, the second period, the third period, and the fourth period, when all the contrast disappear from the arteries. Now, move to the result. Here is the demographic and clinical feature of the research are summarized in this table. All of them are elderly. The female more than male. The cigarette smoking is about 30% and have some comorbidities such as diabetes, hypertension, coronary artery disease, previous heart failure, anemia, and dyslipidemia. As you remember, the duration of arterial phase was calculated and compared with the control. This table shows the result, and the syndrome X groups was divided into 5 small groups, depending on the contrast remaining in the arteries. Here, coloring some information to make it easier to pay attention. In the control group, the duration of the time from plug entry to the end was 1.52 seconds, while it was 3.79 seconds for the syndrome X groups. And the primary delay, which made the large difference, was the period of time when the contrast left the posterior distal artery to the end, and the second delay from the mid-segment to the beginning distal segment. The patient with the cardiac syndrome X had a much longer delay. And syndrome X patient with prolonged myocardial phase had dense and prolonged contrast retention at the myocardium. Now, let me summarize. In the syndrome X patient, the prolonged arterial phase deprived the myocardium of highly oxygenated blood and triggers ischemia. The new image method allows for the better understanding the mechanism of ischemia in syndrome X patient. However, the limitation of the study was that it was a non-randomized observational study with a small number of patients. A large cohort needs to be enrolled to apply this finding within the general population. As for the innovative application, there are many questions. For example, what option does the cardiology have to offer to the cardiac syndrome X patient? Or what is the role of beta blocker in this type of functional ischemia? Or does biventricular pacing help? Further study are needed to be clarified the aforementioned and intriguing question. That brings us to the end of my presentation. Thank you for your listening. Now, I'll try to answer any question if you may have. Thank you.
Thank you for your presentation. As we know, there are two types of X syndrome. This is the metabolic X syndrome and coronary X syndrome. And now the definition of coronary syndrome. Maybe we can use Minocard syndrome. Minocard syndrome that it looks like the type 2 of acute myocardial infarction. It shows the vasoconstriction, and without the lesion, for example, the arterial in the lumen of the coronary artery disease. So with a limited number of patients, 20 patients, but I see you have a big effort to perform your study. Thank you. But I would like to know, do you perform the coronary angiography, or you collect only their result to describe and study? Yes. Can you answer the question? You perform or directly the coronary angiography to study, or you collect only the result of other doctor, other interventionists to describe and to study? Do you perform angiography directly?
Yourself?
No. So this is the research of my leaders. I just presented. So.
I have a question.
Yes, sir.
I have a question.
Yes, I'm listening.
So anyway, generate a high appreciation or effort, but in Vietnam, you should focus very important. That is practicing certificate. Practicing certificate, very important. With the technique, invasive technique like that can result, can cause the death of the patient. That is a permission for a student. It's not permission for a student. So with a student, you should focus on the technique for study based on the practicing certificate by authority of medical health. I'm very strange that with a student like that, you can perform the invasive technique like that can cause the death of patient. It's not permission. Okay? I don't agree with the result. That is the result of the other doctor is not you fail. You real. I don't agree with the result. That the result of the other doctor is not instead of yourself. In our activities, we don't accept the result like that. That is the result of the other doctor. Okay?
Yes, thank you, sir.
So you tried is good, but you should limit your capacity with the permission by the authority of